So hello, good day. My name is Gabrielle Alorro and I'm here to demonstrate the Peripheral and Vascular System Assessment. So let's begin. So hello sir, my name is JV and what's your name?
I'm AR.
So AR, so is it okay kung mag-assess ko sa mong Peripheral and Vascular System? So nalam ko yung mga questions regarding sa mga present health concerns, mga symptoms kaya mga na makakos or affect sa imong peripheral vascular system. So muna mag-wash yung hands and do hand hygiene. So first kay, hindi mo mag-ask, naka-notice ka any color, temperature, or texture change yung skin? Wala ito.
Aside sa kanang brown seed bulat sa adlaw, mas pati na sa ulo.
One, do you experience pain or cramping in your legs?
Wala na.
One, do you experience heaviness and aching sensations on your legs? Or ganang aggravated by standing or sitting for long periods? Like, kung sakit siya, kung duloy ka tindog, or masakit pa siya kung duloy ka maglingkod. One, leg edema, like mga wala po kayo mga varicose veins. One, do you have any leg veins that are rope-like bulging? So, do you have any sores or open wounds on your legs? Wala na. Okay. Kuan, do you have any swelling sa iyong legs or feet?
Wala ba?
Kuan, do you have any swollen glands or lymph nodes? Wala. So, karon sir, kay sa imong personal health history, kuan, describe any problems you had in the past with the circulation in your arms and legs, like blood clots, ulcers, coldness, hair loss, numbness, swelling, or poor healing.
Or wala man.
Stay fast. Kuan, have you had any heart or blood vessel surgeries?
Wala na.
Or treatments? Kuan, do you or does your family have a history for BPD, diabetes, hypertension, coronary heart disease, intermittent claudication, or elevated cholesterol or triglyceride level?
Kaya siguro ng diabetes ito ng hypertension. Usually, kung both sides account, either na diabetic or taas ang blood pressure.
So current sir, sa mga lifestyle and health practices, did you in the past smoke or use on how much or ito ba siya ka-total?
Nitakan ko siya mga 1 year. Then, hindi mo siya everyday. Kasi ito man sa work na tago-tago. Then, ito ito. Brad, yung mga lugar na kasi dahil dahil brad mga 5 sticks siguro per
Well, every session yan. Okay, so concert, exercise ka regularly.
Oh.
Okay, so naka-experience ka, are you experiencing any stress in your life at this time?
Sa karon kay tungod sa studies ko bro. Quarantine man bro, dahil yung mga requirements na kailangan i-pass na bro. Sa akin din ko kapang internet sa bro. Medyo stress.
So, how have your problems in circulation affected your daily function? Wala mo. Do leg ulcers or varicose veins affect how you feel about yourself?
Wala mo.
If ever, sir, maka-affect mo siya sa
Feel ako bro. Really ako.
varicose veins.
Okay. Mag-part mo bro sa pag bro.
Do you regularly take medications prescribed by your physician? Yes. Do you wear support hose to treat varicose veins? Okay, varicose veins. So, thank you, sir. So right now for the peripheral vascular system, physical examination. So, gather your equipment, a centimeter tape, stethoscope, Dr. ultrasound device, conductivity gel, tourniquet, gauze or tissue, waterproof pen, and
BP cuff. So demonstrate courtesy and explain the procedure to the client. Do an hand hygiene and ask the client to put on a gown to provide privacy. So first, the arms. So inspect bilaterally for size, presence of edema, and venous patterning. Inspect bilaterally for skin color and lesions. Inspect fingertips for clubbing. And next is palpation. So palpate fingers, hands, and arms for temperature using dorsal surface of your fingers. Then palpate capillary refill time. Then palpate radial, ulnar, and brachial pulses. Palpate epitrochlear lymph nodes behind the elbow in the groove between the biceps and the triceps muscles. Then perform Allen's test. So first, have the client rest the hand palm side up on the examining table and then make a fist. Use your thumb to include the radial and ulnar arteries. Continue pressure to keep both arteries occluded and have the patient release the fist. Note the palm remains cupped. Note the palm remains pale. Release pressure in the ulnar artery and watch for color to return on hand. To assess the radial pattern, repeat the procedure as before, but at the last step, release pressure on the radial artery. So right now, let's go to the legs. So inspect bilaterally for skin color from the toes to the groin. So then inspect bilaterally for distribution of hair and condition of nails. Then inspect for lesions or ulcers. Note whether margins are smooth and even. Locations such as pressure points, size, depth, and odor. Inspect for edema, unilateral or bilateral. So if cuffs are asymmetric, measure cuff circumference. If client has edema, determine if it is pitting or non-pitting. If client has pitting edema, rate on 1 plus to 4 plus scale. Palpate legs for skin temperature. Is it cool, hot, or warm? Use dorsal surface of the hand. Then palpate the superficial inguinal lymph nodes while keeping the genitals straight. So if detected, note size, mobility, or tenderness. So horizontal lymph nodes, palpate in the groin, and the vertical lymph nodes palpate along the inner aspect of the thigh. Then palpate and auscultate femoral pulses over arteries. Listen for groups. Palpate femoral popliteal dorsalis pedis and posterior tibial pulses. Femoral pulse, place patient in supine position and feel below the inguinal area, halfway between the symphysis pubis and the anterior posterior iliac spine. Popliteal pulse. Have the client bend knees, or if on the table, roll onto some stomach and flex leg for 90 degrees. Press deeply to feel. So dorsalis pedis pulse. Have the client dorsiflex or extend foot. Place fingers between patient's great toe and the first toe, and slowly move away from the toes between the extensor tendons. So for posterior tibial pulse, it is located in the medial malleolus of ankle or tendon of Achilles. Inspect for varicosities and thrombophlebitis by asking client to stand. Deep phlebitis by quickly squeezing calf muscle against the tibia. A Homan's sign by extending leg and dorsiflex foot. Positive if with calf pain. So perform position change test for arterial insufficiency while client is in supine position by placing hands both on the client's ankle. Raise legs 30.48 cm or 12 inches above heart level and ask the client to pump it up and down for 1 minute. Have the client sit up and dangle legs. Note color of feet. Time the interval for color to return. If varicosities are present, perform manual compression test by having client stand. Firmly compress the lower portion of the varicose vein with one hand and place other hand 15.2 to 20.3 centimeters or 6 to 8 inches above hand and feel the pulsation on upper hand. If varicosities are present, perform the Trendelenburg test with client in supine position. Elevate legs at 90 degrees for 15 seconds with legs elevated. Apply the tourniquet to the upper thigh and assist the client to standing position and observe for venous feeling. Remove tourniquet for 30 seconds and watch for sudden feeling of the varicose veins from above. So that is all for the peripheral and vascular system physical examination. Thank you for listening.